muscle tension, headaches, nausea, insomnia, fatigue, trembling or shaking, or chest pain.
All right, so now we'll talk about depression. So again, like anxiety, you've probably heard the term depression, but I wanted to spend a bit of time distinguishing, first of all, between kind of depression in general or feeling depressed versus having a diagnosis of a depressive disorder. So depression or feeling depressed is associated with feeling sad, down, hopeless, empty, maybe. And, most people do feel down from time to time, and it's normal and okay to feel sad sometimes. But with a depressive disorder, when you're diagnosed with a depressive disorder, those symptoms of feeling down and sad are there pretty consistently. So you're feeling that way for more days than not, or nearly every day you're feeling that way. So it's more severe and persistent when you have a diagnosis of a depressive disorder. Depression is also associated with things like losing interest in things that you used to enjoy or that you usually enjoy, or not getting as much pleasure out of activities that like you might have used to before you maybe developed this disorder. Additional symptoms that go along with depression are significant weight loss or weight gain, disruptions to sleep, and that could be sleeping too much or sleeping too little, feeling agitated or restless, or on the flip side, feeling very sluggish or slowed down, feeling very fatigued or not really having any energy, feeling worthless or having really excessive or inappropriate feelings of guilt, having trouble thinking and concentrating and making decisions. And sometimes people feel so down, sad, hopeless when they're depressed that they have recurring thoughts of death or suicidal thoughts or plans. What we know about depression, too, is that like anxiety, there are elevated rates in firefighters. So there's some diagnostic studies that suggest like 11% of firefighters in general suffer from depression. And there has been strong evidence within Canadian samples to show that the prevalence of depression is actually elevated in the firefighter population in Canada when compared to the general population of Canada. So it seems like there's something about the people who become firefighters or the nature of your job that's putting you at greater risk for developing depression. Now, we also know that depression is linked to a person's perceived stress, where the more stress they feel, the more at risk they are for developing depression, and as well their perceived social support, where the more perceived social support they have, the less likely they are to develop depression. Now, this puts you guys at a kind of an interesting situation because your job is really stressful, so you're increased in stress, putting you at greater risk. But also sometimes you're isolated. You might not be around your big social support, so you're even more at risk. Depression is also associated with self-criticism, where people who are more critical of themselves are at greater risk. And it's often associated with workplace injury and chronic pain. And again, because of the nature of your job, where you are doing physically demanding work, and there's some risk to your job physically, you could be at greater risk for injury or pain, and therefore at greater risk for developing depression as well. And then finally, we know that depression, it also can increase the risk for PTSD, which we're going to talk a bit more about in just a minute. But this is particularly relevant for firefighters, and this might actually be even more relevant for seasonal workers as well.
Okay, so the next thing we'll talk about is substance misuse among firefighters. And so you'll notice the slide focuses on alcohol consumption. And we did that because it's really what's most common among firefighters. But these same patterns and negative impacts also apply to different substances like cannabis, opiates, or even prescription drugs if they're not being used kind of as prescribed. So an alcohol use disorder refers to a problematic pattern of alcohol use that leads to clinically significant impairment or distress. And what I mean by that is that alcohol or any other substance is consumed in larger amounts than intended, and that individuals frequently experience cravings for the substance, even at times when that wouldn't be appropriate. So at work or at school or when you're hanging out with children. And so we often see a decrease in kind of productivity at work, school, or at home as a result of this substance use. And then on top of this, individuals with a substance use disorder often develop a tolerance to the substance, which means that they have to consume more and more of it as time goes on. And the more you consume of that substance, the kind of higher risk you are for those kind of negative outcomes linked to it. So firefighters demonstrate elevated rates of alcohol misuse and alcohol use disorder. So one study found that over 50% of firefighters met criteria for binge drinking. In terms of current alcohol use disorder, we saw almost a quarter met criteria. And then if you expanded that for at some point in their career, again, almost half met the criteria. So we see that there's a significant proportion of firefighters that are using substances. And so these high rates of substance misuse are important to acknowledge because we know that there's this connection between substance use and other disorders, in the sense that substance use can exacerbate or worsen the presentation of other negative outcomes. So, for example, we know that substance use is linked to more severe depression, worse PTSD presentation, and a poorer overall quality of life. And so research done examining substance use in firefighters have found that firefighters often use alcohol or other substances as a way to cope with distressing symptoms or stress from the job. And as you all know, your job is very stressful, so it makes sense that we might see this kind of reliance on substances to cope.
So finally, we're going to talk about post-traumatic stress disorder, or PTSD, as you've probably heard it referred to as. So exposure to a traumatic event may result in PTSD. So when I say traumatic event, what I'm talking about is an exposure to actual or threatened death, serious injury, or sexual violence. And this can include direct exposure, witnessing an event, learning about an event, or experience repeated exposure to aversive details of a traumatic event. PTSD is characterized by recurrent intrusive memories of the events, heightened arousal and reactivity, and negative changes in cognitions and mood associated with the event. And individuals with PTSD also tend to avoid reminders of the event, so whether that be internal reminders such as memories or thoughts, or external reminders such as avoiding people and places that remind them of the traumatic event. So not everybody that experiences trauma will go on to develop PTSD, and there are actually multiple factors that contribute to whether or not someone will develop PTSD after experiencing a trauma. So among other risk factors, repeated exposure to a traumatic event, often experienced by wildland firefighters, places you at greater risk for experiencing PTSD, which is kind of going with the theme of all these mental health disorders that we've been discussing. So in fact, a recent study has reported that about 14% of Canadian firefighters experience PTSD, which is again much higher than that of the general population. And PTSD can be really chronic and debilitating, but there is evidence-based treatment available for PTSD. So if you do believe that you're experiencing PTSD, it is really important to seek help for that. And again, like these other disorders, PTSD looks different for everyone. So some people have intrusive dreams, dissociation, hypervigilance, irritability, aggression, difficulty concentrating, fear, shame, anger, and some people just experience feeling really numb as well.
All right, so now that we've talked about all of these disorders that you may be at greater risk for, we want to talk about how people actually cope with that type of those symptoms and the stress that's associated with your job. But before we kind of dive into our helpful coping tips, it's important for us to talk about some really common ways of coping that are not necessarily helpful. So what we know, and we've already alluded to this, is that your job is very stressful. The nature of your work is stressful. And there's also been some evidence to suggest that within the organization or the work that you're doing, there's also kind of increased experiences of stress associated with like experiencing or witnessing incivility, harassment, discrimination, violence in the workplace. And so all of that adds an even greater level of stress. So it's safe to say that there's a lot of stress associated with your job, and people need to find a way to cope with stress. So whether you're dealing with mental health concerns or heightened stress, it's really common to cope in these following ways that I'm going to go through. So the first is avoidance. So avoidance is where you avoid situations where you know you're likely to become stressed out or worried or feel uncomfortable sensations or feelings. So an example of this might be if you're worried about a work situation, maybe you call in sick. Or if you are worried about being around other people and you get invited to a party, you might not go. So you avoid putting yourself in the uncomfortable situation.
Here's what I found.
Sorry. And so in the thing about avoidance is that it helps in the immediate short term. You feel relieved, right? So you don't have to put yourself in that uncomfortable position. So you feel a decrease in your discomfort. The problem with avoidance is that it helps in the short term, but it doesn't do anything to help prevent those feelings in the future. Similarly, distraction is when we attempt to cope with a stressful situation by distracting yourself and not allowing yourself to focus on the source of discomfort or worry or stress. And so an example of this might be when you're feeling anxious, you play really loud music so you can't focus on anything else. Or if you're in an uncomfortable social situation, maybe you take out your phone and are pretending you're using it so that you don't have to kind of talk to the other person. So both avoidance and distraction do kind of reduce our feelings of stress, anxiety, or discomfort in the moment. But the problem with this is that we can come to depend on these situations. And if we're in a situation where we can't avoid or distract, we actually become even more stressed out than we would be if we were to just face the situation head on in the first place. So we actually make it worse for ourselves. And although avoidance and distraction are not harmful to you, they're not helpful in the long run because they're not helping us change our ability to handle stressful situations. And they kind of subtly teach us that these situations are worse than they actually are. And then the final common way of coping that's not necessarily helpful is using drugs and alcohol. And Laura already kind of alluded to some of these issues, but it is very, very common to use alcohol and drugs to cope with mental health symptoms, stress, discomfort in general. And what we know is that actually 1/3 to 1/2 of people who develop a substance use problem actually began their cycle of abuse by self-medicating their discomfort or their anxiety, their stress. So it's really common to use this as a coping strategy, and it's not helpful. And in fact, unlike distraction and avoidance, using drugs and alcohol to cope is actually potentially harmful. It's pretty dangerous. So this is because we develop dependence and tolerance on these substances really quickly. And that means that the person needs more and more of the drug to get those calming effects. And so as the person increases their consumption, the calming properties of those substances actually become less and less, which feeds into that cycle of abuse.
Okay, so before we get into the skills, we wanted to explain this cognitive triangle because it'll help you kind of understand why the skills that we teach today might work for you. And so the cognitive triangle shows that our thoughts, our feelings, and our behaviors in response to a situation are all related to one another and can influence one another. So your interpretation of a situation is going to impact how you feel, think, and behave. And so to help this hit home, we'll run through a situation together that's listed on the slide. So due to last year's dry conditions and limited overwintering precipitation, you know that there's a high likelihood for significant fire activity this season. So in response to this situation, one person might have the thought that they're going to get a lot of work this season, leading to more experience and more money. They might then feel excited or relieved to know that they'll have work. And as a result, they might get themselves prepped to be deployed or chat with colleagues about the upcoming season. Now, on the other hand, in response to the same situation, a person might have the thought, I'm going to have to leave home a lot. These fires might be really dangerous. Maybe the fires are going to be more out of control than they've been in the past. And if these were the thoughts going through their head, they might feel apprehensive, stressed, maybe even sad or worried. And then as a result, they might avoid prepping. They might avoid thinking about it. They might become irritable when their families or friends bring up the topic, or they might even try to find a reason to get out of work. And so as you can see, the way that we interpret a situation changes how we think, feel, and behave. And so if we have a negative thought, it's likely to lead to negative feelings and behaviors. But on the flip side, if we have a more positive thought, we might feel more positively overall. So you can think of it as kind of a positive cycle or a negative cycle. And so the best thing about this connection is that you can learn skills to target the different components in order to break this negative cycle if it's happening to you, and hopefully kind of feel better overall.
So we really want you guys to come away from this presentation with some things that you can actually do when you're experiencing these negative thoughts or when you find yourself stuck in this negative cycle that Laura was just referring to. So we're going to work through a few helpful coping strategies. We're going to be discussing paired muscle relaxation, or sometimes referred to as PMR, self-soothing, and two types of thought challenging, one called examining the evidence and one called decatastrophizing. And research has shown these strategies to be helpful for coping with anxiety and stress. So they are evidence-based. They're not just things that Laura, Jen, and I think would be fun for you guys to know about. They are evidence-based. However, if you're experiencing or think you may be experiencing some of the other mental health concerns that we discussed, so depression, substance use, or PTSD, these strategies will not likely be enough for you. And at the end of the presentation, we're going to provide some resources that might be more helpful for you if that's the case.
So like Bria said, paired muscle relaxation is referred to as PMR. And it's a mindfulness strategy that can help you feel more connected and in the present moment. So it helps people refocus their attention on things that they can control and reduce overall feelings of distress. And so PMR works by tensing and releasing different muscle groups and really focusing on the difference in feeling of those muscles when they're tense versus when they're relaxed. And so PMR is a really portable skill because it doesn't require you to use anything else than the body you're living in. And another really helpful reason why we use PMR is that by practicing tensing and releasing your muscles intentionally, you can start to notice when you're feeling tension in those muscles and then be consciously able to relax them. So before putting all the pieces together, I want us to just practice tensing two different body parts, and I'll explain how to do each of them. So we're going to start with our hands and wrists. So I'll count down from 3, and when I say go, I want you to make fists with both of your hands and then pull your fists up onto your wrists, okay? And then you'll hold the tension until I say relax. So I can't see any of you, but I assume that you're going to be following along. So 3, 2, 1, go. Relax. And try to focus on the difference you can feel in your hands from when they're tense to when they're relaxed. So the next one we're going to try together is our forehead. And I like doing this one because it feels a little silly, and I find I can really feel a difference between the tensed and relaxed states. So again, I'll count down from 3, but when I say go, I want you to pull your eyebrows close together and wrinkle your forehead as hard as you can. Okay? So 3, 2, 1, go. And release. So now that you've practiced doing that, we're going to put it all together into a kind of sample PMR activity. So as you can see on the slide, there's a whole bunch of different muscle groups you can try this with. But for today's presentation, we're just going to do it with our hands. So I want you to get comfortable, relax, loosen any tight clothing, maybe, uncross any body parts that are crossed, and make sure you're comfy in your chair. And so I'll count down from 3, and we're going to inhale and tense our fists. We'll hold this tension as we inhale for 5 to 6 seconds. And then when you release and breathe out, you can say the word relax. You don't have to say it out loud. You can say it in your head, or you can say it out loud with me. And then we're going to repeat this 2 times for the sake of today, but you might want to do it 3, 4, 5 times when you're doing it on your own. So 1, 2, 3. Relax. We're going to do it again. 1, 2, 3. Relax. So you would repeat this a few times with each muscle group that you decided to use. You could do it with just one muscle group at a time, or as you get better, you can practice pairing a few of these groups together. And like I mentioned earlier, if you're noticing some tension in different parts of your body, practicing tensing and releasing will make you realize what you have to do in order for those muscles to relax. So the next strategy is called self-soothing. And these strategies have been shown to be really effective in helping people cope in times of distress. And so self-soothing helps pass the time when we're feeling upset without actually making anything worse. And so it involves doing things that feel pleasant, comforting, or provide relief from stress or pain. And you can use your 5 different senses as kind of inspiration for self-soothing activities. But before I give you specific examples, I just wanted to clarify that self-soothing isn't the same as distraction, because you're using these skills intentionally to keep you in the moment. And in fact, you're acknowledging that you're not feeling your best and then using this skill to help you feel better rather than using a distraction strategy to feel nothing at all. So I'll give you a couple of examples for each sense listed on the slide. So for vision, you might watch a movie, look at a calming sunset, watch TikToks on your phone. For hearing, you might blast your favorite music or try to notice different sounds in your environment and pick those out. For smell, you might try lighting a scented candle or baking bread, maybe even using your favorite shampoo or body lotion. For taste, you could try eating your favorite food, but it could also be something as simple as mindfully eating a piece of gum and really focusing on kind of that minty taste in your mouth. And then for touch, you might hug someone you're close to, take a warm shower, or pet a pet that you have at home. So you might notice that you're already doing some of these activities in daily life, which is awesome. The difference about self-soothing strategies is that you're consciously and intentionally engaging in these activities as a way to cope, rather than just doing them kind of in daily life.
Okay, so now we're going to move on to the next skill, which is all about thought challenging. So a few slides back, Laura spoke about the connection between thoughts, feelings, and behaviors. And she really tried to drive home the idea that what we say to ourselves affects how we feel and what we do. And that sometimes we say things to ourselves that are untrue and or unhelpful, and that actually makes us feel a lot worse. And we call these things negative automatic thoughts. So negative automatic thoughts are specific negative self-statements that occur automatically and which we're often not even aware of. So we can think of these as thinking traps that we can fall into. And some of us are wired to fall into these thinking traps more often than others, but they are extremely common and we all do it from time to time. So what we want to do is try to catch these unhelpful things that we're telling ourselves and challenge whether or not they're really true. So we're going to discuss 2 skills that can help us challenge these thoughts when we notice them happening. The first one's examining the evidence, and the next one is called decatastrophizing.
All right, so I'm going to talk about examining the evidence. But before I do that, I need to explain the thinking trap that we might fall into where we need to use examining the evidence. So this thinking trap is called probability overestimation. And it's kind of a technical term to just explain the fact that we have a tendency to jump to negative conclusions. So this is an example of how when we're stressed out, what we say to ourselves is not necessarily helpful or even true sometimes. Sometimes we actually lie to ourselves and unfortunately, we actually convince ourselves that this negative conclusion is really likely to happen. So probability overestimation is when we result in an incorrect prediction of how likely it is that a certain outcome is going to happen. And like I said, you're jumping to a negative conclusion, essentially. So consider the following scenario as a way to kind of drive this one home. So imagine you get the call that there's a rapidly growing wildfire that needs immediate attention. It's in a remote area, and you're told that you'll need to be flown in by helicopter. As soon as you hear this, you immediately start to think about the last time that you were in a helicopter and how scary that experience was. You immediately begin to feel nervous, and you're getting more and more nervous every time you think back to your experience, and you're worried about getting back on the helicopter. And then you also worry about how these nerves about being in the helicopter will actually affect your ability to do your job. So in that situation, you may immediately think to yourself, oh my gosh, well, the last time that we were in a helicopter, we barely got out alive. It was a mess. That's going to happen again. Or, worse, the helicopter is actually going to crash this time. Or you might say, I'm going to be so worked up about being in the helicopter that, if we do actually land safely, I won't be able to help because I'm going to be so just kind of distressed and overwhelmed. So ask yourself, how likely is it that those bad things will happen? What are the actual chances that those bad outcomes will happen? In the moment when you're thinking this way and you're feeling so stressed, it's probably going to feel like the bad thing is really, really, really likely. Like the chances are, you might estimate 80 to 100% that this bad thing is going to happen. And that's kind of your brain convincing you that the bad thing's going to happen. It's kind of lying to you. And if I was to say to you in that situation, it's actually not that likely that the bad outcome will happen, because statistically we know that there are way more safe helicopter rides than helicopter crashes, or a person is not usually completely incapacitated when they feel overwhelmed, and they're still usually able to kind of get things done. You would probably have a hard time believing that, and you would probably say, no, I'm sure this thing is going to happen. I feel 100% sure it's going to happen. And it's because the possibility of that bad thing happening is so scary that it overrides everything else in kind of your rational thinking in that situation. So unfortunately, what ends up happening when people kind of fall into this probability overestimation thinking trap is that they try to find support for the anxious thought or the negative thought. They remind themselves of all the reasons why this bad thing is going to happen, rather than trying to see why their prediction might not be accurate, or reminding themselves of reasons why it might not happen. So that's what we're going to focus on with examining the evidence. So with examining the evidence for probability overestimation, we essentially need to look for information that goes against the negative or anxious thought, that goes against this idea that this bad thing is going to happen for sure. And essentially, we're going to challenge our thinking. So in order to do this, we have to remember that our thoughts are not facts. So just because we think something doesn't mean it's true. Our thoughts are actually just guesses. So they're just one interpretation of many possible interpretations for a situation. We saw that with the example of the same situation, two people thinking completely different ways about it. And our interpretation is just one, like I said, of many possible interpretations. And we know that because of the way our brains work, when we're stressed, our interpretation is likely to be biased to be negative. And so it's not really a fair situation for our thoughts. You can switch it, Laura. Perfect. Thank you. So in order to challenge probability overestimation, what we need to ask ourselves to examine the evidence is things like the following. What are the real odds or chances of this bad thing happening? How likely is this bad outcome really? Like from a rational statistical standpoint, for example. Has this really bad thing ever happened before? What is the evidence that it won't happen? And what else might happen? What are the alternative outcomes of this situation?
Another thinking trap that is quite common is called catastrophic thinking. And so that is in addition to overestimating the likelihood that an event will happen, which is what Jen just discussed, anxiety and fear often arise from viewing an event as dangerous, intolerable, or catastrophic when in actuality it isn't. So often if you stop to examine the event realistically, it's usually the case that it's not as catastrophic as you might have first thought. However, there are some situations where the worst case scenario is catastrophic, and I'll talk about that a bit more in a couple minutes. So if you imagine this scenario on the slide, so you receive a call from your supervisor asking you to fly out to fight a fire in a different province as soon as possible. You're chatting for a moment and they mention to you that it's the worst fire they've seen in their 20 years of work, and you hang up the phone call and you find yourself wondering what you're getting yourself into. So if you find in this scenario that you're really going to the worst case scenario and kind of it just keeps snowballing and getting bigger and bigger, then it's likely that you are experiencing this thinking trap of catastrophizing. So when this happens, we want to decatastrophize. So the steps to decatastrophizing would involve first imagining the worst case scenario. So sometimes that's like goes against everything in us, right? We kind of want to push it away and avoid thinking of the worst case scenario, but that actually makes things worse. What can be helpful is trying to allow yourself to go there. Imagine what is the worst case scenario in this situation. Try to think about how likely is it that that is to happen and determine the severity of that situation. And then decide how you would cope with it if that did happen. So if the worst case scenario is to happen here, how am I going to cope with that? So the next time that you find yourself experiencing anxious thoughts, try to ask yourself, if the worst possible thing that could happen did happen, how would I cope with that? Now, of course, in your line of work, sometimes a worst case scenario can actually be catastrophic. So for some situations, certain types of challenging are more helpful than others, and certain types of techniques may be more helpful. And it can also be really helpful to remind yourself that you are able to handle really bad situations, and you came into this line of work knowing you were going to be put in really difficult conditions, and you have coped with them in the past. So just kind of keeping that in mind, but also keeping in mind that some skills are going to be better than others in different situations.
And then the final step, once you've actually challenged your thinking, is to replace those kind of automatic negative thoughts or the thinking traps with a more balanced or realistic perspective. So after you've examined the evidence, you want to essentially come up with a more balanced thought. And balanced thinking takes into consideration both sides of the story. So evidence for this negative thought that you are falling into and evidence against it. So we're not asking you to just see the world through rose-colored glasses. It's not about pretending that everything is rainbows and daisies and that nothing bad will ever happen. You are in a challenging profession. There is risk, and some bad things do happen. And so it's not about just pretending that doesn't happen. It's about acknowledging both sides and not falling into the negative thinking trap without acknowledging the fact that it's not 100% certain that that negative thing is going to happen. So when you, for an example about balanced thinking, when you're coming up with a more balanced thought, from the helicopter scenario, for example, a more balanced thought in that situation might be something like, even if this helicopter ride is really bumpy, really scary, a crash is not as likely as I think it is in this moment. And even if it is a very scary ride, I have faced many scary situations and I'm always able to pull it together and do my job. So that kind of acknowledges that, it's probably not going to feel good. It's going to be uncomfortable, and it's probably not as bad as I'm making it feel in the moment when I'm thinking about it. So when you first start thinking more in a balanced way, when you're in these situations, it might be helpful to write down a more balanced perspective that you could look at when you're feeling overwhelmed, or repeating a more balanced, realistic thought in your head over and over. That can be a potentially useful coping strategy in the moment. But the good thing about thought challenging and thinking realistically is that the more you practice it, the more automatic it actually becomes. You're more likely to actually notice when you're falling into a thinking trap. And then you can actually challenge the thought more kind of automatically. And ideally, when this becomes even more automatic, you might actually begin to challenge you might be actually be coming up with more balanced thoughts as easily as you might have come up with the negative automatic thoughts in the first place.
Okay, so we've thrown a whole lot of information at you today. And so if you take anything home with you, we want it to be these three kind of following things. So the first is that it's normal to experience mental health concerns for everyone. And then in your line of work, it actually increases your propensity towards experiencing these symptoms of depression, anxiety, substance use, and PTSD. So keep that in mind if you notice that you're feeling these symptoms. And there are a few strategies that you can take away that might be really helpful. So skills like PMR, self-soothing, and the 2 thought challenging strategies that Bria and Jen taught. It's also important to know, though, that there are times when these skills that we've presented won't be sufficient. And so please don't hesitate to ask for help and to get adequate care. So the skills that we've presented today are really helpful when you're feeling stressed, but they aren't a substitute for mental health treatment. And so on that note, we have a couple of resources here that Bria will talk about.
Yeah, so we've provided some federal resources here, including the Canadian Suicide Prevention Hotline and some numbers from the Federal Employee Assistance Program. But Maria has also agreed to send out some province-specific resources via email following our presentation, so that is lovely. And I just want to also add that we were using wildfire examples throughout this, but these skills are very generalizable and can be helpful with everyday stressors. And in addition, they can be shared with others in your life if you notice that they are falling into these common thinking traps. So we were using very specific examples, but these are helpful if someone's feeling anxious about going to a party, or if there's a test coming up, or if there's a job interview. These same types of skills are very generalizable. So just keep that in mind, whether for yourself or for others in your life that they might be helpful to share with. And we also want to thank you all for taking time out of your Fridays. Very beautiful Fridays for some of you to come and listen to us. And we'd be happy to answer any questions now. If there is, I think there's been some in the chat, so we can address those. But also Maria can provide you with our emails, and you can reach out to us with specific questions if you'd feel more comfortable doing it in that way.
Thank you so much to Laura, Bria, Jennifer, and Dr. Oltius for taking the time with us today. As you mentioned, as they had mentioned, I will send a follow-up email with some resources, as well as so kind to provide their email addresses. I'll send them as well. We've got some time for questions, as they had mentioned, so feel free to put them in the chat while they are populating. I'll just mention a few things. There were some comments in the chat regarding a real obvious need for some national coordination and at least sharing resources. There's some really great things happening in some of the agencies that, we really need to find a way to share that amongst ourselves. So just kind of scanning back here, I see Steve Lemon from BC had asked around, there's some US specific mental health among wildland firefighters resources in the US. Is there any in Canada? I don't know if you can speak to that, but there's an obvious need for us to be able to bring that all together, to collect it all. And I think we're starting to see that be needed at the national level. So if anyone is aware of any resources, feel free to put them in the chat. In the meantime, you can reach out to me so that I can share them with the community. I think the long-term approach would be working through the CIFFC resource management committee and figuring out a way that we can officially do this. But just to that one particular question, I guess I'll hand it back over to you if you're aware of any resources, Dr. Olthius, or any of the students there.
Yeah, I can answer this. So I would say Steve's comment is kind of right on in terms of the availability of research on wildland firefighters does mostly, almost entirely come out of the States. So there's been definitely an increase in research into first responders and firefighters, like structural firefighters more generally in Canada over the last decade. So some of you might be aware there's what does CIPCERT stand for? Canadian Institute for Public Safety Research and Training. So they've been doing a ton of great research in first responders and firefighters out of Saskatchewan, but it has predominantly been structural firefighters. So hopefully we'll see an increase in wildland firefighter research. I mean, even just personal experience, some of the early research we did was in structural firefighting, and it was really our own participants in that research who reached out and were like, there's this whole other group of us who do wildland fire, and this stuff isn't necessarily the same, and it warrants attention. So that's super helpful for us because it's really opened our eyes to another population that's in need of some attention and figuring out what's going on and how we can best help. So people are becoming more into, researchers are becoming more in tune with that, I think, but like Steve suggested, mostly in the States.
And I see the question too from Jessa Barber below about this 14% stat. That was the one that I said, so I can field this question. It actually wasn't, sorry if that wasn't clear, it wasn't a stat for specifically wildland firefighters. It was a firefighter stat that came from that research that Janine's kind of speaking to. I can provide the reference. It's a study that looked at public safety personnel across Canada and included firefighters, but it would be structural firefighters. So that 14% isn't for wildland firefighters. It's just included because it's kind of, as Janine was saying, the best we have to go off of right now, not necessarily a direct representation of wildland firefighters, but gives us a bit of an idea that likely the rates are going to be elevated as well, given the intensity and severity of the type of work.
Excellent. And as mentioned also in the chat, there's some really great programs out there, Working Minds for First Responders. And Dr. Olthia is shaking her head. I think she's familiar with that one. And then and so, we may have an opportunity here in upcoming sessions to share these programs with the CIFFC community. And then really great news from Steve Lemon there, looking to work with the Canadian Mental Health Association and giving a wildfire specific approach to resilient minds. That's really great news and great work happening there. I'm just going to scroll down.
Yeah, and I'll just say, Maria, a lot of the things that Laura and Bria and Jen touched on today are some of the similar types of strategies that are covered in the Resilient Minds program. Just there's a lot of focus on visualization, positive self-talk, breathing, those kinds of things. So you can see that the strategies are very comparable as to what was mentioned today. And generally, relatively positive perspectives on that program. I would say the biggest challenge that we notice a lot of the time is follow through. So there's a lot of kind of initial excitement about getting a program set up, and, early psychoeducation sessions, but then sometimes things tend to fade a little bit. And so I would just hope that, or encourage a lot of people in their implementation to think about how are we making sure that new firefighters are getting some of this info, or that we're checking in every once in a while, that people are using skills and strategies. But I think from one of its main goals is reducing stigma perspective. It seems to be helping quite a bit with that too. So.
Oh, that's great. Yeah, and there's lots of things in the chat here, boots on the ground. So I'll add that to that email when I send out to all the participants afterwards with those resources. And then just scanning through here, there is a question, I believe, from Michelle Young. Do you see that one there?
Yeah, I can see it. It's a really interesting question, Michelle. So she asked if the sources of stress impact the risk of mental health disorders. So one thing that's really interesting about our bodies is they're super bad at distinguishing where the stress is coming from. So I could be terrified because a bear is in front of me and my life is in danger, or I could be terrified because I have a job interview tomorrow and my body doesn't really know the difference. It knows like severity, so how stressed am I? But it doesn't really distinguish between sources. So that's a really interesting question. And the answer is it doesn't, severity, it definitely distinguishes, but not necessarily types. So I don't know if anyone else has anything to add to that, but
yeah,
really.
I was just gonna say too, like no matter what the source of the stress is, some people are more kind of biologically equipped to deal with stress and are just more resilient, and some people are a little bit less and then are at greater risk. So it's not necessarily a one-to-one, like stress equals disorder. It's like for some people I would have to go through like 100 really stressful things and then I would develop a mental health disorder. Some people might have one really stressful event and then they develop a mental health disorder. So it's very individualized. So I would say it's less about the nature of the stress and more about the nature of the stress interacting with the person.
Mm-hmm. Yeah, so we think of it in terms of like you have a predisposition, right? And so that can be genetic, it can be based on, so many different factors. And then you have the environment. So what is happening around you? And the more exposure you have to stress, regardless of what that stress is. So it could be, you're doing job interviews every day, or you're really anxious and you have exams every week, or it could be, exposure to trauma, then that makes you more likely to have these symptoms overall. I'm also noticing there's another question here. Is there a difference between short-term acute stressors that is more common with structural versus what we usually experience, which is very prolonged stress? Absolutely. In the sense that it's kind of like it works in kind of a cumulative way. So the more stress you have, the kind of worse the outcomes might be. And like Bria said, there is a difference in terms of the severity of stress. Like one really big stressor may be equivalent to many small ones, who knows? But it also depends on kind of the individual person and how their response to stress.
I think what you can think of too is like, if you have a kind of bucket full of coping to deal with an acute stress, and you have the acute stressor happen, and then you have time to use your bucket full of coping to kind of deal with that and replenish the bucket, then it's full again for the next one, or maybe close to being as full. But if you experience a prolonged stressor, over time the bucket empties and you never have a chance to replenish that bucket. And so it sort of just takes a little bit more of a wear and tear on your body. So just to add to what that was.
Great, thank you. I don't see any other questions. We'll just maybe hang out here for a moment or two and see if there's any other being generated here. What I will do is, as I mentioned, I'm going to follow up with 2 emails. One of them will be immediate, just because this may have triggered something for you. I want to get those agency resources out right away, and then it'll be a couple hours, and I'll send out just this follow up with some of these resources that we've got in the chat. So that's great. Yeah. Just looking it through the chat here.
And I know sometimes things will come up like after the fact, even if it's next week or you're telling someone about this and someone has a question, please do feel free to reach out to us. We don't mind at all. We love talking about this stuff. It makes us feel important when you have questions for us. So definitely feel feel free to do that.
Well, thank you so much. It's been such a pleasure. It says here we'll have some follow-up questions. And wow, thank you so much for providing your time, volunteering your time to be with us today. That's quite incredible and so professional. I'm really looking forward to when you're done your PhD and out in the world. I think we're all in really good hands. So I think
just have a little bit more research to do.
And thanks for joining us the day after St. Patrick's Day. We're all looking very awake. That's great. So thanks everyone for joining us. Again, there will be some resources coming to your inbox, and we'll be in touch. Jennifer, Laura, Bria, and Dr. Oltius, thank you so much for all your help.
Thanks for having us, Maria.
Take care.
Thanks, everyone.
Bye.
Bye.